Thanks for the introduction. And good evening, professors, doctors, and ladies and gentlemen. My name is Ting-Yu Su. I'm a pediatric resident now of third year in Kaohsiung Changgen Memorial Hospital. And it's an honor for me to stand here, and I'm a bit nervous now, to present one of our research with you. And the topic of our research is salivary cytokine, a non-invasive predictor for the development of bronchopulmonary dysplasia in preterm neonates. So, in previous studies, it was well known that cytokines were strongly associated with the development of BPD. For example, the elevated levels of interleukin 6, 8, 10, and interferon gamma in the blood, and also the decreased level of interleukin 17, TNF-beta, and RANS were associated with the future development of BPD in preterm neonates. As for that, in the tracheal aspirate samples and the bronchoalveolar lavage, elevated interleukin 6, 8, 10, and interferon alpha was associated with the future development of BPD. However, most of these methods of cytokine detection were invasive and may cause iatrogenic anemia or iatrogenic trauma to these tiny little neonates. So we tried to find a non-invasive way to do the same thing, to detect the cytokine levels in these preterm neonates. And we came up with an idea. How about we check them in their saliva? So with this idea, we enrolled patients from August 2012 to May 2017. And those we enrolled includes premature neonates younger than 34 weeks gestational age with positive pressure support. And since the infection interferes with the presentation of cytokines greatly, we exclude those with infections at the first step. So we collected the saliva sample on the first and seventh day of these little neonates with sterile suction tubes, and put the saliva samples inside Eppendorf tubes frozen under -80 degrees Celsius. Finally, the cytokine levels of these salivary samples were detected by multiplex Luminex bead assays. And the cytokines we detected includes interferon gamma, interferon alpha, TNF-alpha, and interleukin 6, 8, 10, 17, and 33. The statistic method we used included Kruskal-Wallis test, Pearson chi-square test, and logistic regression test. And initially, we enrolled 186 neonates, and 43 of them were excluded at the first step because of maternal or neonatal infection. These includes maternal sepsis, chorioamnionitis, or CMV infection, and neonatal sepsis, pneumonia, or GBS infection within the 7th day of life. And unfortunately, 18 of them were also excluded due to mortality. Finally, 125 patients were enrolled in our final analysis, and they were separated into 4 groups according to the severity of their BPD. And there were 33 in the control group, 26 in the mild BPD group, 25 in the moderate BPD group, and 41 in the severe BPD group. So when comparing the salivary cytokine levels in these 4 groups, we draw some box plot for the representation, and the x-axis represents the severity of BPD from control group to the severe BPD group, and the y-axis, as shown here, represents the level of the salivary cytokines. So in these box plots, we noticed a trend of elevation of these salivary cytokines with the severity of BPD. And these cytokines include interleukin 6 on day 1 and day 7, and interleukin 8, 10, 17, and interferon gamma 1 on day 1. In Kruskal-Wallis test, the star shows that the cytokine levels in BPD groups were significantly higher than that in the control group. However, it was known that in the severity of BPD were negatively and strongly associated with their gestational age and birth weight. So we tried to adjust for the effect of these two factors. And after the adjustment in logistic regression, all these differences became non-significant. On the other hand, although there were no significant in the four groups in the day 7 interleukin 17 and day 7 interferon alpha 2, after the regression test for gestational age and birth weight, the level of interleukin 17 on day 7 became significantly lower in the mild, moderate, and severe BPD group. And the level of interferon alpha 2 on day 7 became significantly lower in moderate and severe BPD group. So our conclusion is that the level of interleukin 17 and interferon alpha 2 were negatively associated with the severity of BPD in our neonates. And to explain our results, we found some review articles about the function of these two cytokines. And it was known that in Nature Immunology, it says interleukin 17 is a chief orchestrator of immunity. It acts in synergy with many other chemokines and cytokines for the recruitment and stabilization of neutrophils in the infection sites in our body. Also, it helps us maintain a healthy respiratory epithelial border. As a result, if a neonate has lower level of interleukin 17, it will be more prone to infections and respiratory system damage. So it has more chances to develop BPD in its future life. As for interferon alpha 2, it's an important cytokine against viral infection. And since we excluded the neonates with bacterial infection and common congenital infection at the first step of our study, the role of viral infection in our neonates may be highlighted. So, as a result, if a neonate has a lower level of interferon alpha 2, it may be more liable to viral infection and thus having more chances of developing BPD in its later life. So, our conclusion is that saliva is a less invasive and feasible source for cytokine detection in these tiny preterm neonates. And early life salivary cytokines include especially the IL-17 and interferon alpha 2 levels on day 7 were associated with the development of BPD. Our results added a new view of salivary cytokine expression to the pathogenesis of BPD and may help us predict and prevent this critical pulmonary disease early and gently. Finally, I have to thank my teacher, who were also seated, Dr. Huang and Dr. Chen, for leading me into the field of research, and also thank for my research team for giving me so much advice and help on this topic. And I have to introduce where I came from. This is the location of our hospital in Kaohsiung, which is a city in southern Taiwan. And it's a city with sunshine, beaches, delicious food, and passionate people. So if you get a holiday or get a meeting in Asia, please welcome to Taiwan for a visit. And thanks very much for your attention.